Good evening. How is everyone this evening? Better, do better. How is everyone this evening?
Woo-woo.
All right, thank you very much. Thank you for joining us for yet another edition of Science on Tap. My name is Andrew Lyon. I am the Dean of the Schmid College of Science and Technology, and it's awesome to see so many people here enjoying beer and science, and we don't have to prioritize those tonight. Before we get started, let's first give a big round of applause for Chapman Crafted for hosting us. A few ground rules if you haven't been to Science on Tap before. Science on Tap is a really simple, low-key discussion between myself and somebody who does awesome stuff, okay? That discussion is going to proceed for about 20 minutes, where we're just going to talk a little bit about what gets our visitor up in the morning and excited about coming to work at Chapman. In the interim, yes, beer gets Georgiana up in the morning. Is that really what you meant? No, okay. So after about 20 minutes, your glasses should be mostly empty, which means you will want us to stop talking and you will want to go over there and fill your glasses again. But you will also then be full of fantastic questions to ask. That's what the note cards on the tables are for, okay? So after the first 20, we'll break. You'll have time to write your questions down. You'll have time to go get a new beer. And then you'll come back and we will ask your questions only if they were truly awesome questions. If you ask and we choose one of your truly awesome questions, you get a free beer ticket, which is redeemable at any Science on Tap event. If you come in here when there is not Science on Tap going on and you walk up to the bartender and give him that ticket, he will not know what you're doing, okay? So you need to redeem them only during Science on Tap events. With that as a preamble for how this all works, let me introduce our speaker this evening, Professor Georgiana Bostean, who's going to tell us a little bit about herself.
Thank you so much, Andrew. Can everyone hear me okay? All right. So go refill your drinks. My science sounds a lot better when you have a full glass. I'm an assistant professor of environment, health, and policy here at Chapman. And what gets me out of bed in the morning is not actually beer. I was being facetious. It's population health disparities. What does that mean? I'll talk about it throughout the talk, but understanding why some groups live longer and healthier lives than other groups. So I have lots of students in my lab who collect data, some of them here today, thank you for coming, woo woo, and analyze data to understand what it is about our social environment and our physical environment that shapes our health.
So talk a little bit more about that. In particular, the title of your talk relates to something, a tale of two cities, et cetera, et cetera. So what do you mean by that when you say a tale of two cities and how different places or spaces might impact our health?
So let me start off with a question. If I tell you the life expectancy of Asian Americans in the US is nearly 87 years at birth. That's the highest life expectancy in the US. And we compare that to the lowest life expectancy in the US among African American populations on average, which is nearly 10 years less. If you had a number in your mind to attribute the percent of that difference attributable to genes and biology, what would that be? Just think of it in your mind. What percent of the life expectancy difference between the longest lived groups and the shortest lived groups, what percent of that would you attribute to genes and biology? Would it surprise you if I said that it's less than 10%? How much of that do you think is attributable to social factors? Would it surprise you if I said 60%? So 60% of population health differences are attributable to social and ecological factors, and less than 10% are attributable to genes and biology. So that 60% is what I'm interested in, and that's everything from our social relationships, the neighborhoods that you live in, what's available in those neighborhoods. So the tale of two cities, and actually I'll get into new data that allows us to go even beyond the city level, but the tale of two cities is really how if the same person were born in one city versus another, they would lead a completely different life and have potentially much longer life and much healthier life if they live in one place versus the other. So why A Tale of Two Cities? Well, when I developed the title, it sounded really snazzy and historical, so that's why I went with that. But we actually have data now at the census tract level. What's that? The US Census, which is coming up pretty soon. I encourage you, if you get an enumerator at your door, to give them all your information. But every 10 years, we have a census that counts all of the individuals in the US and gets really basic data about them. We now have data for life expectancy at this census tract level, which comprises about 5,000 residents in a census tract. There are multiple census tracts within cities. So I'll give you one example, Santa Ana, we live nearby. There are parts of Santa Ana where the life expectancy at birth is 5 years longer compared to other more disadvantaged areas of Santa Ana. 5 years is a huge amount of time if you think about just the difference between someone living in one neighborhood, one part of a city versus another part of a city. So our lab is interested in figuring out what are the characteristics of those places that shape lives to be healthier, unhealthier, or longer than other areas. So what are the ecological characteristics that shape that?
So I'm going to throw you a curveball and go off script. I know you can handle it. You've looked a little bit at how this relates to populations that maybe move from one location to another. So how does population migration, how do you measure that, and what kind of effects do you see there?
Great question, Andrew. He's the dean, I get to say that. That's the only time that I get to say that. So if you had to guess, would you think that immigrants coming from lesser developed countries that maybe have worse healthcare systems and more infectious disease have better or worse health than people that are born here in the United States? So show of hands for immigrants who come from lesser developed nations have worse health than people born here in the United States. Kind of intuitive, yeah, thanks. Okay, I fed you that one. It's actually opposite. Most immigrant groups that come to the United States have longer lives than people born in the United States, even though they come from countries with far lower socioeconomic status, far less developed medical systems, more infectious disease, etc. That's what we call a paradox or a conundrum in the scientific literature. There may be elements of who's likely to move, so a selection effect that affects who ends up being a migrant to begin with, right? People who migrate maybe are more likely to be healthy to begin with, because if you're sick, you aren't going to uproot your life and move to another country, right? So that may be part of the puzzle. The other part of the puzzle may be what happens when you get to the US and how your health behaviors change. So immigrants may come to the US and have healthier behaviors because even though they came from less socioeconomically advanced countries, they may not have eaten as much fast food. They may have engaged in more physical exercise. And so the context here in the United States, combined with who's likely to move, both influence immigration differences. Now, within the United States is much more tricky, so I'm going to defer on that for now.
Okay, fine. I'll let you go. So in conversations we've had previous to this, you've talked about kind of organization or arrangement of spaces and how proximity effects between one particular effector and another population might also influence things. Could you talk a little bit about your research in that area?
Yes. So the title of the talk has both place and space in it. So what are the characteristics of place that might affect health? Things like parks. If you have a park in your neighborhood, not shockingly, you're much more likely to use a park and to engage in physical exercise. If you live in a neighborhood where there are fresh fruits and vegetables available at a supermarket, as opposed to only corner stores that have limited capacity to sell fresh fruits and vegetables, you're far more likely to eat healthy, right? So those are place characteristics that affect health. Air pollution is another one of them. If you live near a freeway, if you're in a neighborhood that's near a freeway or near a point source of pollution, you're much more likely to experience negative health effects from these. Now, space and the arrangement of space is a different element to how place affects you. I love this study conducted by Google. It perfectly exemplifies my life. So Google did a study within their offices looking at how they could increase consumption of water and healthy snacks and decrease unhealthy snack consumption and soda consumption. All they did was move the unhealthy snacks from clear jars into opaque jars so that you couldn't see the M&Ms as clearly, and moved them behind the healthy foods, right? This is all it takes, is moving it from here to here, making it just that more difficult to eat the unhealthy food. And they decreased unhealthy snack consumption, sorry M&Ms, and then they increased consumption of healthy snacks. For water, moving it from below the soda and down below eye level, moving it up to eye level, increased water consumption and decreased soda consumption. Really minute changes in their micro office environment, and that led to really large changes in health behaviors. Now, I challenge you, when you go back onto campus, take a look at the vending machines. Look how much water there is compared to how much soda there is in the vending machines, and look where it's positioned vis-a-vis the soda. I might as well just tell you the punchline. There's one line of water, and it's at the very bottom, below 5 rows of soda in the vending machines, right? So Google found this out, has empirical evidence. We know this to be true at the micro level. This is also true for communities. How we arrange the space, our neighborhoods and our communities, affects our health behaviors. So my research lab focuses on tobacco-related behaviors. So there's some literature that suggests that the greater density of tobacco retailers there are in a neighborhood, the more likely, particularly youth, are to smoke. So why do we care about youth populations and smoking? Well, we know nicotine addiction happens at young ages. So if you capture smokers and get them addicted to nicotine at young ages, they're much more likely to be lifelong smokers. So in our lab, we collect data on where are there tobacco retailers located in neighborhoods. We're also interested in where youth are located, so we map out where are the schools, where are there parks, where are there other child care facilities, and where are tobacco retailers in proximity to that? How many tobacco retailers are there? How close are they to the child serving facilities? And are they very dense? And then what are the retailer behaviors? Do they put signs, exterior signs, showing discounts for student IDs? We actually see this in our data collection. Some places have student ID specials here in Orange County for tobacco retail. So this affects youth behavior, right? And probably adult behavior as well, but let's be a little more libertarian and say we don't care what the adults do. But for youth, it certainly matters. So the arrangement of space at both the micro level and the community level affects our health behaviors. So we often, living in this individualist society, think, well, you know, I choose how I want to eat and you know, what types of vices I want to engage in. But really, that's shaped very strongly by the environment that we live in. So thinking about how to create environments that support healthy behaviors is one of the goals of our research labs.
I just had a flashback to my college years where there was a convenience store between my house that I lived in off campus and the bus stop. And full disclosure, I was a smoker at the time, easy to buy cigarettes. And then I smoked Camels because I had a huge collection of free t-shirts. That was the time when Camel would give away free t-shirts just for buying a couple of packs. And so yeah, I'm wondering where that wardrobe went. So if we think a little bit about that space versus place, and think a little bit about presumably the business strategies that we have here, how does one think about kind of the policy implications, right? So you're a member of the Environmental Science and Policy program, so you must think a lot about how one might tweak policy to change how companies exploit that space and place question.
So yes, this is a great question. How do we balance between individual rights to do whatever you want as an adult, and how do we create policies that support healthy change? So In our lab, we think about other policies that have shown to be best practices in other places. So I'll give a couple of examples. And it's so much easier when we apply it to other countries because it sounds like, oh, that's really attainable. In Sweden, which is always used as the sort of gold standard case, they have a program called Vision Zero for traffic safety. Instead of thinking about drivers as being individually responsible for safety, they shifted that with this Vision Zero policy program. They shifted that responsibility to the designers of roads, creating roads that would maximize safe behavior and that would reduce fatal traffic accidents. That's a really different way of thinking about who's responsible for what, right? And of course, Sweden would think that way because they're much more collectivist in that way. But they were able to reduce traffic fatalities a lot by instituting, instead of traffic lights, roundabouts. Roundabouts force people to slow down, unless you see them on YouTube going kind of through and over the roundabout, which happens every once in a while, but far less often than people running red lights at intersections, right? And with far less fatal consequences for multiple drivers. So that's one example of a policy that shifts responsibility from individuals to the designers of those environments. Another great example is multi-unit housing smoking policies. So to go back to my interest in tobacco, it's sometimes tough to get individuals to change their behaviors, but by putting social pressure on them, it makes it much more likely that they'll change their behaviors. And we saw this in California. California was the leader in reducing smoking rates in the nation. And if you were alive in the 90s, you remember that change was largely due to social pressure through smoke-free policies. You were no longer allowed to smoke in public, and when you did, eventually, people started looking at you and giving you dirty looks, like, what is that person doing? Who smokes in public anymore, right? So social pressure changed people's perception about norms around smoking and made it less likely for them to smoke. Using that same approach in multi-unit housing protects a lot of lives. We have still some smokers, approximately 10–15% of Californians still smoke. It's a fairly low number, but they often live in communities with other folks, right? And so thinking about the secondhand smoke exposure, which we know second and third-hand smoke exposure, meaning through the walls and the residue of smoke products, tobacco products, remains in the walls and goes through electrical outlets and seeps into other people's properties. So if you frame it not just as a question of individual rights, but a collective responsibility to protect public health, not just one's own individual desires, it's much easier to think about how, for example, creating smoke-free policies in multi-unit housing can protect everybody's health, not just the immediate family members of the person who's smoking.
I didn't have any social pressure. All my roommates smoked. And then I came to a conference out here in California, and that was like super uncomfortable, right? I didn't realize that I was one of the bad actors. Yeah. With that, let's pause. So I see a few low glasses, probably not enough. I'm a little bit disappointed. But if you feel the need to refill your glass, go ahead. Please think about awesome questions to ask because that earns you more beer. If you walked in late, again, there's note cards on the table. Feel free to write down questions. If we choose to ask them, that gets you a beer ticket for tonight or next time or any subsequent Science on Tap. And with that, we'll take a break. Thank you. All right, and we're getting back here, ready to ask your brilliant questions, which are so brilliant and so numerous that Professor Bostean is having trouble prioritizing. So I'm putting her under an extraordinary amount of pressure right now.
Okay.
We're good?
Yes,
Okay.
I think so.
This is the stack? This is the magic stack? You're sure about that? Oh, goodness gracious.
Y'all are a really good group.
You're going to the back of the stack for that one, right? That's unacceptable. Okay, so recall, If I ask your question, own up to it, raise your hand, you'll get a ticket, okay? Use it now, use it later, don't use it when I'm not here. All right, we understand? Those are the rules. So, number one. Oh, before we hop into that, do you want to talk a little bit about the sheets that are on the tables?
Sure. So you'll see these little QR codes in front of you. You can use your cell phone to scan the QR code or go to the link if you're interested in seeing some maps that relate some of the information that I shared with you about vape stores and tobacco retailers and proximity to schools, specific to Orange County. So if you're interested in vaping and seeing a little bit more what my students have pulled together, feel free to take a look at that.
But don't do it now because that means you won't be paying attention to us, and that would be bad. Okay, question number one. If a group knew about the results of studies, such as Google's, would that affect the group's lifestyle and dietary choices? Oh, that's an awesome question. Who asked that question?
Such a good question.
Right in the back over there. Awesome. That is a Foundation Trilogy question for the geeks in the audience. I guess nobody's read Foundation Trilogy, Asimov rules. I'm sorry. Go ahead.
So this is an excellent question. No, I don't think that's enough. So how many of you know that you should be getting 5 to 9 servings of fruits and vegetables every day? Pretty much everyone. And how many of you get 5 to 9 servings of vegetables every day? Almost nobody. So, is just knowing enough? No, because we're human, and sometimes there's beer right in front of us, which makes it very tempting to drink beer and, you know, have dessert and go to the corner store to buy a snack or go to the vending machine because you're really hungry and there's nothing else available on campus than a bag of chips. So, no, I don't think it's enough to be aware at the individual level. I think we need to be, and this is totally my bias, right? I'm a social scientist. My bias is that I think we create environments that support our healthy behaviors. If you are familiar with the book Nudge, it's a bit old now. It's 10 years old, by the Nobel Prize winner in economics, Richard Thaler and Sunstein. They argue using behavioral economics, which, by the way, is pretty much just social psychology. Sorry, did I say that on video? My bad. So they argue that really we need to make the default choice the healthiest and best choice because we have so many choices to make on a day-to-day basis and we rarely make the best ones. We spend way more time trying to choose what to watch on TV than choosing the right retirement plan. And this is actually an example that they use, right? People are much more likely to opt into programs like being donors, organ donors, when that's the default choice, as opposed to when they have to check the box to be an organ donor. Same thing applies to our health behaviors. If you make the default choice the healthiest choice, we're far more likely to engage in that than if it's the more difficult thing that we have to go out of our way to do. So for me, it's a no-brainer. We've constructed environments that make it difficult to be healthy. We just need to reconstruct those environments in order to make it easy to be healthy.
And I think the term that Thaler and Sunstein use in that book that I love is something like paternalistic libertarianism, right? You know, like letting people think they're making their own choices when you're really pushing them in a particular direction through paternalism. I love that.
Which stores do to us all the time, by the way. Have you been to Fry's? Do you know the like half a mile that you have to walk to get to the cashier area, and they have snacks and everything that you would not have bought otherwise, but you're going to because now you've walked by it, right?
It's true. That's why the escalators are annoyingly arranged in the mall, right? Okay, so do you think we could collectively as a country shift policies and behaviors enough to become a smoke zero nation? And if this is attainable, how far down the road do you see this happening? Who asked that wonderful question? Over here in the corner. Thank you.
Wonderful question again. I think this is a global question. I think every country in the world is asking itself, how do we get to that point? And no country has gotten there yet, regardless of how collectivist or individualist their policies are. So that's a very difficult question without outright global banning of tobacco. And my inclination is to say no, because people need some outlet. So the other thing with smoking and drinking and all, and in my case, Oreos, eating Oreos, right? We all need some sort of an outlet. We live stressful lives, and we all have coping mechanisms, and sometimes those involve health behaviors that aren't that healthy, right? We use eating as coping strategies, etc. So I think we need to recognize that there will always be a need for that in societies in which there is any level of stress, and certain groups experience disproportionate amounts of stress. And so maybe the prospect of shorter life with more chronic disease at the end of it is worth it if that cigarette at the end of the day is the one thing that gives you respite from the, you know, the fact that you don't know where your next meal is coming from, that you're going to provide for your family. So I think as a social scientist, it's incredibly difficult to parse out our the daily stresses that we experience on an individual level that then aggregate to a population level. And that's why we see these population health disparities that I started with. Why some groups live longer than others, a large part of that is the way that our lives pan out from the moment of conception, what your mother experiences, the levels of stress that she experiences at the time of conception, and throughout your life. And your risk of being a preterm baby is affected by that. Your risk of being miscarried is affected by that. Then whether you make it to age 1. So all of these things are intertwined throughout our daily lives to the day that we die, right? Everything that we experience. And those things are patterned for groups in our society. They don't occur at random for everybody. They're very much patterned by what race or ethnicity you embody, what gender you are, what country you come from, what age you are, what time you are living in, right? If you were born today versus if you were born in the 1970s, you're going to experience a very different context. So all of these things pattern our lives such that we have these stresses. And so I think the goal of zero smoke is certainly where everyone wants to get, because smoking is the #1 cause of lung cancer mortality. But whether that is actually possible, I'm highly skeptical. So sorry to end that on a cynical note,
But now we've seen the interconnectedness of Science on Tap, because the prenatal and the maternal health and all of those questions we answered last season with Professor Laura Glynn. If some of you were here, I guess no. But so yeah, it all comes full circle. How those contexts really influence you from before your birth. With e-cigarettes being marketed as an alternative to smoking, how does this affect or impact the policy making in regards to smoking? Who asked that question? Right here in the front of the room. Hold your hand up. There we go.
Yay. And it's a Chapman Panther. So thank you for asking that question. How many of you have been seeing the headlines in the last few weeks about the FDA calling youth smoking an epidemic? Yeah, this is a huge issue. So I think this is a really timely question. So e-cigarettes were plausibly designed to be smoking cessation tools. They came on the US market in approximately 2008. So we only have about 10 years of data, and actually less than that, because by the time people got funding to start studying them, develop the studies, started collecting the data, if they're collecting longitudinal data, it takes a few years, then you have to analyze the data, then you have to publish it. This is a long road, right? Science takes a while, and certainly for enough science to accumulate in order to have a conclusion on this, it takes quite some time. But the evidence as it stands right now is showing that there's limited evidence that there's any benefit of vaping for smoking cessation. So the National Academy of Science put out a report earlier this year saying, based on the evidence that we have so far, we don't think that using e-cigarettes has any better effect on smoking cessation than the existing FDA-approved smoking cessation tools. So why has the FDA been cracking down in the last couple of weeks? Because it seems that there's a disproportionate effect on youth vaping. So vaping may be attractive to smokers who are trying to quit. Anecdotally, my aunt and uncle swear that they quit smoking using vapes, but now they just have like 3 vapes and they're constantly in their mouth. So I'm like, I'm not sure that that's actually any better than smoking. But so, okay, there's some anecdotal evidence that they're quitting smoking. But the impact on youth starting to use vaping that hadn't smoked before and that probably wouldn't have smoked otherwise is disproportionate. The spike, especially after Juul came out, the spike in vaping went back up last year. And so the FDA is really concerned that there is strong evidence that youth who didn't smoke, who start vaping, go on to smoke. And even though vaping is substantially healthier than smoking, it's not better than not doing either of those, right? So I think this is the big challenge with the evidence, is that people vape, youth who didn't smoke go on to vape, then go on to smoke. And so the FDA is really cracking down on that. So actually, did I even answer the question? Marketed as cessation tools, what?
How does this impact policymaking in regards to smoking?
Yeah, so it impacts policymaking because people are trying to figure out, should we regulate vaping in the same way as we regulate smoking? If there's a benefit to smokers to help them quit, then we don't want to limit access to smokers, right? We want to help smokers quit because it is better to vape than to smoke if you quit completely. But there's evidence that that's not actually happening, and that instead what we're seeing is flavors particularly are really attractive, because who doesn't go, oh, unicorn milk, that sounds kind of cool, especially if you're in your 20s and there's a student ID special, and there's...
Even if you're in your 40s, that sounds awesome.
Yeah. And there's a vape store right near, anyhow, I'm not going to tell you where it is. You can probably find it on the map on my map. But anyways, so the point is that there's disproportionate population health impact of people starting to vape and smoke that hadn't, compared to how many people are quitting smoking as a result. And so that is the conundrum for policymakers, including the FDA. And the FDA seems like they've done an about-face, whereas initially a couple of years ago they said, you know what, we're going to push back the timeline to regulate in hopes that the technology will evolve such that vaping could be a viable tool for cessation. It hasn't, and in the interim we've seen a huge spike in youth use, and so now we're considering much tougher regulations on the top manufacturers, including Juul.
That was a great question, but you still only get 1 ticket. This question comes from somebody who obviously has insider information. I'll read it verbatim.
Okay.
You've talked a lot about your research group exploring these questions about space and place, but word on the street is that you managed to find these questions, feed these questions into your teachings. How? Can you chat a bit about how you engage students in these important questions? I bet you that came from a student or a faculty member. Guessing. Who asked that question?
Don't be
Professor
shy.
Keller. Shocking. Shocking. Professor Keller's over there, and he looks like he needs another drink.
Thank you for that. I wanted to give a shout out to students, and that was a perfect way to do this. So, to be perfectly honest, you know who brought vaping to my attention? My students, because I'm an old curmudgeon and had no idea that this was going on until 2013, when one of my students said, you know, we've been talking a lot about tobacco retailers. Have you thought about vape stores? And I went, oh. And now she's actually finishing grad school at University of San Francisco, so she's amazing. So how have students gotten involved in this research? Well, they're the ones who came up with the idea of studying vape stores as we have tobacco retailers. We know from the tobacco literature that there are effects of proximity to schools and of density of retailers on youth behavior, but we didn't know if this was true with vaping because it was such a new behavior. So I have had several students over the years that helped collect data on this. So they very meticulously went through Yellow Pages and Google and Yelp reviews and collected data on where these vape stores are located, and then collected data on where schools are in all of California. then got data from surveys on 70,000 students in Orange County. We didn't collect the 70,000. That would be super impressive, but I don't have money for that yet. Not wink, wink.
That's a good grant.
But they analyzed data from 70,000 students in Orange County, asking if they had vaped, and linked that with where their school is located and how many vape stores were near that school. And we found that for students who attended middle schools that had vape stores nearby, they were far more likely to have tried e-cigarettes, suggesting that even if they weren't buying from those particular retailers, right, online sales are really common, we know that, but just the visibility aspect of the vape stores and seeing them on their way to school potentially, on their walk to school or drive to school, might have the effect of making them seem novel or more popular than they really are. So students have really been integral in collecting and analyzing this data, and we have someone here who has been looking at census data, for example, not related to the vape retail, but at bikeability. So one of the aspects of active living is being able to engage in active transportation. Really difficult in Southern California. We all drive to work, right? Because our streets are not very bikeable. So one of the students here has been collecting data on, quote, bikeability, figuring out what makes a community bikeable, how do we map that, and then are there disparities between low-income areas and high-income areas in how bikeable areas are, right? That might explain some of these population health differences in how likely people are to engage in physical activity and other healthy behaviors. So that's how I integrate some of these research questions into teaching, and actually these students are very much actively participating in the research design and analysis process, and they are super awesome. So shout out to you.
So we already talked a little bit about this topic, but I guess it's time to expand upon it. A lot of the policies you describe resemble the quote-unquote choice architecture proposed by Thaler and Sunstein in their book Nudge. In the UK, they created a quote-unquote Ministry of Nudge, and this is just an example of how it's been embraced in other countries. So the question is, why, in your opinion, has this failed to catch on here? Who asked about nudge? Right here.
The other social scientist in the room. Great question. So I think it's a cultural difference in how we perceive responsibility for health behaviors, right? So in the UK, some of the public health practitioners, which you're familiar with, but I'm going to say it anyways. Richard Wilkinson was one of the authors, and Michael Marmot, on the Whitehall studies, which were some of the first studies in the 60s and 70s to find large disparities by socioeconomic status in life expectancy and other health conditions. They, in the UK, were much more quick to embrace the idea that these are remediable, that these are modifiable risk factors. And so I think the political and social context of different countries really shapes their policy approaches. And so telling people in the UK that creating a default option in certain health behaviors is more likely to be acceptable. And also they have a much more centralized approach to policy than we tend to do in the US, right? So we tend to be a little bit more piecemeal, a little more state-based. So I think for us, it will really depend on state and local level policies, whether we can move towards a nudge-based approach, quote unquote. And actually, just to riff off of that really quickly, we were having a great discussion at the break about state versus local level ordinances for tobacco policy, and I think this is a great example. So we already have state level policies in California for minimum age to purchase tobacco, for licensing regulations, but that's not been enough to reduce our smoking rate even lower and to prohibit or to prevent illegal sales to minors, for example, because it doesn't provide enough enforcement monies. So the state money from licensing only allows the state to check in on about 7% of retailers throughout the state. That's really low. Local ordinances and local licensing regulations allow the cities to have money to implement and to enforce some of these regulations and to do attempted buys with minors, to really seek out which retailers aren't adhering to regulations. This has worked really well in the city of Burbank, for example. They instituted local licensing and have really brought down the rate of illegal buys by minors substantially. So again, it's a balance. I think it's a cultural issue. In Orange County, we have very few local level ordinances for tobacco control that go beyond the state ordinances, and we just have a history of more libertarian policies in general in Orange County. So I think we as a culture have to decide what is more important. Do we think that life expectancy and guiding groups of people and individuals towards healthy behaviors is a collective issue, or should be simply an individual responsibility? Great question.
Yeah, that's a fantastic answer. I'm personally fascinated by this area. I'm going to give 3 reading recommendations, and Georgiana, if you have additional ones, please. Obviously, you need to go out and read Nudge if you haven't read it. Nudge is a fantastic book. 2 other books that are kind of along the same lines or touch on some of the same topics are a book that really explores why people do things that maybe seem counterintuitive. It's called Mistakes Were Made, But Not By Me. It's about cognitive dissonance, okay? And then a 3rd book that I'll put on your reading list is called Denying to the Grave, which is why people make bad decisions about their own personal health. You have any to add, Georgiana?
A little bit unrelated to health, but I think if you read it closely, you can see why it matters to health. The Paradox of Choice, which basically argues that too many choices runs us amok. And so I highly recommend that one. It'll also make you feel better when you walk into the supermarket and just want to scream because there are too many things on sale.
I actually know a guy whose company develops VR, AR approaches to allow you to experience, if you're a retailer, experience a supermarket so that you can know beforehand what the optimal placement of your product is. So basically, he's developed a VR, AR approach to having somebody, say, from Coca-Cola, walk through a supermarket and track where their most likely gaze will fall so that they can choose very precisely where their product should be placed. It's insidious.
That really creates a whole different perspective about what individual choice is, right? You'll look at your daily life in a whole different light if you're aware of these marketing strategies.
Right. Yeah, I mean, this guy's behind the scenes just kind of picking and choosing how you shop. He's telling you how you should shop, and you really don't have a whole lot of freedom of choice any longer. Sorry to break that news to you. So with that, we are at the end of our hour. I'm very sad to report that. Please join me in giving a big round of applause to Professor Bostean.
Aww, thank you.
Thanks once again to Chapman Crafted for hosting us. Thank you to the folks from Panther Productions for making us look and sound awesome. Thank you to all of our student, staff, and parent volunteers who have been here to help this be an awesome event. And finally, thank you to Ms. Sarah Buckley, who makes this all happen every month. Thank you, Sarah. Who's got the flyer on their table? Can you pass that up to me? I don't have committed to memory who's next on the agenda. Oh, thank you very much. And now I got to put my glasses on. Okay, here we go. Monday, the 26th of November at 6 p.m. We will have Professor Gregory Goldsmith, who is the director of Schmid College's Grand Challenges Initiative. And the title of his talk is Solving Wicked Problems in the Sciences. A little bit of a preamble. That will not just be Professor Goldsmith. So if you know Professor Goldsmith and you don't like him and you don't want to hear him talk, it's okay. Still show up, because there'll be at least one student team here talking about their experience in the Grand Challenges Initiative. I see at least one GCI student here, or maybe she left. Oh, maybe she left. She left. I'm sorry. She had studying to do. Exactly. Yep. I was going to embarrass her. So Grand Challenges Initiative is an amazing program with really cool student teams who try to tackle the biggest challenges this globe experiences. And Greg Goldsmith is going to come talk about why that's a cool thing to do educationally. And then the students are going to talk about what they've actually done. And so you get to talk with the students directly for once here at Science on Tap. Again, thanks for everybody attending. Spread the word. This is a fun place and a fun time. See you next month.